Hi, this is Sam of the American Acupuncture Council, and we're really happy to bid you a happy new year. And to start the new year, we really want to have this program to really focus a little bit on the business side. Ultimately, as an acupuncturist, though you are a healthcare practitioner and your main goal, of course, is helping your patients, getting them to feel better, giving them solutions to their healthcare issues, it also is still going to be a business end. And one of the things I like to discuss at the first of the year is always just dealing with what about insurance? Should we do it? Should we not? Maybe some of you are on the fence about it. So I want to take a little time today to spend some moments with you to kind of get you to understand what is insurance, but also how to verify it, how to really start to set up. And ultimately, what I want today to be is we're going to get a chance for you to know what two insurance companies do and don't cover. We're going to go over Aetna and Cigna, what codes they allow and don't allow. So that way you can make a decision when a patient comes in with any of those plans. You might take them when there's a covered service, but when there's not a covered, you can let them know it's not going to be covered. So let's really just dig in and start talking about what really is insurance. And I think often people take this the wrong way. Insurance is not health insurance. That's why I put this health insurance with a question mark. It's really sick insurance. There has to be something wrong. We'll make them better. It's not preventative. It's not something to keep them healthy, unfortunately, in that way. There's got to have something wrong. How I want you to think of insurance, though, is whether it can be an aid to your practice and bringing patients, it aids in paying for services. It doesn't pay in full in most instances. One of the things that a lot of, I think, consumers think is, oh, I have insurance that covers everything. And of course, we're all acutely aware that there's deductibles. There's co-pays, there's co-insurance, and always there's some part that the patient has to pay. But bottom line is, let's say we have a $100 acupuncture visit. If a patient's insurance can pay half of it or 75% of it, they're more likely to use the service. And really, that's what it comes down to. We want to get patients in your office because you can't help anyone that doesn't show up. Now, this doesn't take away and doesn't mean you won't have cash patients. But what about the patient that does have insurance? Do you want to utilize it? So let's kind of get into why would we even do insurance? Is it really worth it? And I think that's something to be said. And be careful. I would suggest that no one should be a only office. I would certainly not want to see someone say I only do insurance, and certainly to say I only do cash. And the reason why I'd say that is if you only do cash, you're going to eliminate a lot of potential patients. Well, let's take a look. A cash patient, if you will, is someone that generally has no insurance. You know, obviously, if they have no insurance, they're going to come in and pay you cash. The question I have is, how many visits will they come? I bet most of you listening to this has had a patient that's paid cash, and you might recommend 8 visits, 5 visits. But let's face it, maybe after 2 visits, they feel pretty good, so they don't complete the care. And so there is some downside to that because sometimes patients don't see as much value or they feel good enough, and because they're paying out of pocket, they can't afford it. Now, where else would a cash patient be? Someone with a very high deductible, obviously. If a person has, in my opinion, $1,000 deductible, that certainly is likely a cash patient, obviously, because who's going to spend $1,000 or $2,000 at the doctor? Most people don't. How about policies that simply, though they have insurance, has no acupuncture? Only 5 states under the Affordable Care Act require acupuncture, so therefore we know there's going to be a lot of policies that don't. The good news is a lot of policies do. The other place, of course, it's going to be cash is where it's supportive care or maintenance care. I'm a big believer in it, as I'm sure most of you are. Patients and people should understand to make themselves healthy, but that's not insurance. Insurance doesn't pay for you to have a good diet. It doesn't pay for you to exercise, yet those are important things to keep you healthy. So where does insurance really fit? Well, here's why I want you to think of taking at least some insurance. Nearly 9 out of 10 Americans have health insurance. Now, based on the new year and taking away the mandate, maybe not as many will have it, but the majority do, because you remember, most people do get insurance through their jobs. And when you have insurance, generally you're going to try to use it, and you're often not going to go to the doctor when you don't have it, or not go as much. And a Gallup poll found that the uninsured rate now in the United States is about 11%. So therefore, it's clear that there are going to be a lot of people with insurance. What I want you to be able to do is know whether or not, should I take it, should I not take it, and understand whether or not there's a value to you. Don't ever feel bad in saying you take one insurance and not the other. Just because you take Blue Cross does not mean you have to take Aetna or Cigna, or vice versa. Never feel beholden to any one. It is your choice to choose which insurances you do or do not take. You do not have to take everything. So let's kind of get into what someone presents with insurance. What do you have to do? Well, one of the things you need to do is do a verification. Now, this part is a bit tedious, but it's not as bad as most people think. In reality, when you get a patient, often they're going to refer other people they work with. So once you verify insurance on one patient, when another patient shows up with the same policy, you won't have to go through this whole page that I'm showing here. All you'll simply have to do is find out whether the policy is enforced. And in many instances, that can be done online. But it is important to know what does the plan cover? So let's take a moment to go through this insurance verification and what things you might need to do. Well, the first thing you're going to do, of course, is get all the patient's information. Frankly, where you see this, just get the patient's ID card. Make a copy of it. When you make a copy of it, you're going to notice it's going to have all this information, phone numbers. In fact, make sure that if you have a copy when you call, that way you're going to have all the information, and then you want to start writing down this information of what they cover. One of the things to note, though, is please, when you speak to this person on the phone, find out who you're speaking to, get a call ID, because whatever they tell you, they have to stand behind. Every state has a law for misrepresentation. If they misrepresent benefits, they will have to cover it. But most importantly, we want to make sure we have a record of it. Because if any of you have ever called insurance, I'm sure you've heard this statement. It says this call may be recorded for quality assurance. In fact, that call is being recorded. So it's always going to be a record so you can go back to it. One thing to know, though, is where do I send the bill? And that's often people go, where do I send this bill? Always ask the insurance, where is the billing address? Now, most often that billing address is on the back side of the card. So when you get that insurance card, take a look at both sides. Another factor to ask the insurance, though, is how much time do I have to bill this insurance? What's the time limit for filing? Be careful. Insurance is not open-ended where you have forever to bill. Here are the standard rules when billing insurance. You generally have 12 months from the date of service. However, be careful. There are some plans. These are self-insured, sometimes large and group insurances, many times union plans. They could have time frames as short as 30 to 90 days. For instance, the VA that has very good benefits now for acupuncture does have a 120-day limit to send a claim. If you send a claim late, it will automatically be rejected. So be very careful when you take a plan or a patient with insurance. Make sure that when they come in, my rule, bill the same day or the next day. Don't hold on to these things for months because you can run out of time. So always ask, what's their time limit? It should mostly be a year, however. Now, what you really want to know, and this is important, do they have acupuncture benefits? That's really the whole issue. Call them and say, do you have acupuncture benefits? But you'll notice on the right side here, it has LAC, MD, and says 2706 rule. What is that referring to? Make sure the acupuncture benefits cover when performed by an acupuncturist. There may be some old plans that might say, oh no, we only cover when done by a medical doctor. That rule is pretty much extinct based on what you see here where it says 2706. The 2706 rule is part of the Affordable Care Act that says you may not discriminate. And so what this means is there should be very few plans that if they cover acupuncture, they will have to cover acupuncture as done by a licensed acupuncturist. Many states had a rule like this, New York and many others. And of course, because of this change, acupuncture became much better coverage. So bottom line is, do they have acupuncture? But notice highlighted in blue just below, it says in and out of network. Something very important. What if a person has a policy, but it only has in-network benefits? If you are out of network, obviously that means there's no coverage with you. You might as well stop the phone call right there because they're not going to have any benefits. If they have both in and out of network benefits, great. Notice just to the right of it here, it says, is provider listed? That's mean ask. Make sure, am I in the network? I have a lot of providers that say, hey, Sam, I think I'm in the network. What I will say to you is don't think no. Know and understand every plan that you belong to. And if out-of-network services are provided, will they be covered by a licensed acupuncturist, meaning you? Most often, if it's out-of-network, it should. But please, important, just because a plan says it covers acupuncture, don't assume it covers in your office. Potentially, it could be MD only, though not likely. Also, the in or out-of-network. The next thing to ask, and this is probably the most important, if there's out-of-network benefits, will they send payments to the doctor or honor the assignment? Bear in mind, Blue Cross and Blue Shield does not send payments to providers who are not in network. So even though it may have coverage, the patient may get the check, even though that you set an assignment. So be conscientious of it. The other thing, of course, is that a lot of people have these, Affordable Care Act plans or Obamacare, and you want to find out what type of plan they have. And you'll see these plans listed as bronze, silver, gold, so forth. Generally, I will tell you, if they have a low metal, meaning a bronze or a silver, those types of conditions or that type of plan will have very limited, very high deductibles. So that will be something certainly to know. Most people don't have Obamacare plans, though. So bear in mind when someone doesn't have an Obamacare plan, that's just going to be the regular employer one. Those could have much better coverage. One thing to get here is, does the plan require any pre-certification or pre-authorization? Most do not. However, if it does, if you don't do the pre-authorization, that means you're not going to get paid. So notice what we're doing here. Before taking an insurance, we're going to find out about it to know whether or not is it worth it. Because you might decide, I'm not going to take a plan that I have to do pre-certification. And I would certainly say I would blame no doctor for not taking that plan, because that's additional work you may not want. But you got to balance the cost-benefit ratio. What if the plan pays a very good amount with a little pre-certification? I don't mind. But what if the plan pays a very limited amount? That extra work may not be worth it. Now, here's probably the biggest part of it. When they do have acupuncture benefits, you want to ask very specific questions. What are the treatment limits? And sometimes these limits can come in several unusual ways. Sometimes it could be a number of visits, meaning you get 12 visits per year, 20 visits per year. Once those visits are exhausted, that means they have no more. So if they tell you the patient has 15 visits and they've already used 10, logic tells you there's 5 left. Sometimes there's a money cap, meaning that they have $1,500 of benefits. Sometimes it's a number of days. Believe it or not, there are some Cigna plans that will pay up to 60 days only per condition or diagnosis. Also, are there any limits to diagnosis? Now, this is what's going to come up after we do this verification. I'm going to give you the codes that are allowed from 2 different major carriers, both Aetna and Cigna, on a national level as to what they cover. And what I want you to start to do is understand that certain codes will be paid, certain won't. So that way, when a patient comes with a condition, you can decide to take it based on telling the patient, hey, you have Cigna, and when you have this condition, it will pay. Or when you have Aetna, maybe for this condition, it doesn't. The other factor beyond just the acupuncture information is knowing, does it combine with anything? Some of these plans will combine the benefits for acupuncture with chiropractic or physical therapy, naturopath. So make sure you not only check the number of acupuncture visits, but does it combine with anything? The other factor that's good is, obviously in most states, licensed acupuncturists can perform more than just acupuncture needling. So you'll see here it says, does the plan pay for PMR services? PMR stands for Physical Medicine Rehabilitation, so-called physical therapy codes. And you notice just after I have PPACA, that stands for the Patient Protection Affordable Care Act, which of course is commonly called Obamacare. But what they do is an equality rule. So let's say, for instance, you're in a state and you need to do some massage or tuina, some body work on this patient, manual therapy. If that plan pays for manual therapy to a chiropractor or a physical therapist, it too has to pay it to an acupuncturist. So if you apply physical medicine services as part of your adjunctive treatment, it's worth asking whether or not it's going to be covered, because often it should be, because most plans have coverage for it. In fact, something interesting here, if a plan has no acupuncture, if the plan has physical medicine benefits and those physical medicine benefits are within your scope, those too should be covered just to you. So you notice I have a few things here. What about weight loss? In some states, obviously, an acupuncturist can do nutrition. So if there's weight loss, that'll be covered. Other states may have things like smoking cessation. That could be covered as well. And notice each time I highlight the PPACA, meaning the equality portion of the law, which means what we're trying to do is just make sure, does it cover or not? Don't fool yourself. I will certainly say, if someone has a plan that pays $100+ a visit for acupuncture, I'm not turning that patient away. Why wouldn't I want that patient to come in when they have that type of benefit? At the same token, what if a plan I have to be a member that only pays $40 a visit? I may not take that one because it doesn't cover the amount of work I have to put into it. So something else beyond just knowing that is we move down, it talks about specific coverage of services. So you'll notice here, I've just listed some common things acupuncturists might do. Obviously, exams, acupuncture, cupping, moxibustion, and so forth. I'm not suggesting that you do all of these services, but may do some. What's important to know is any of these services you do, while you're on the phone, ask them, do you pay for exams? If they do, find out, is there any copay, coinsurance? Is there a limit to it? Do they cover acupuncture? That's kind of obvious. We've already asked that question. But what about cupping and moxibustion? There is no direct code for cupping and moxibustion, but there are some plans that will pay for it based upon using what's called the unlisted code, 97039. Anyway, something worth verifying. Do they cover massage? Acupuncturists often do a lot of massage as part of their protocol. So if you're doing massage, is it covered? If it's not covered, no problem. That could be something paid by the patient. Again, we're just trying to help them get an aid. Think of it this way. What if the plan covers acupuncture, but doesn't cover the massage part? So let's say the acupuncture you bill out is about $100. The massage is an extra 50. The insurance company pays 80%. Well, the patient pays the 20%, but also pays separately for the massage. Same thing applies with manual therapy services, whether gua sha, tuina, things of that nature. Do they cover manual therapy? Do they cover exercise? Notice the heat, hot packs, infrared, and so forth. Again, I'm not suggesting that you have to do all of these services or any. It's just a matter if you do, find out what's covered. Notice what we're doing here. What I'm trying to set you up to do is to know this insurance so that now you'll know exactly what they will and will not pay for. And the good news now is I can go to the patient and tell the patient, hey, this service is covered, but this one is not. And then the patient can make a decision as to what they could receive based on the affordability of it, if you will. Ultimately, what we do with this information, though, is I want you to write this information down on a separate spreadsheet. And I'd like you to have a spreadsheet in your office of every insurance you bill. Now, that's not as daunting as it seems, because frankly, most of you aren't going to bill as many insurance as you think. There's truthfully only about 6 major insurance companies in the whole United States, and they have lots of subsidiaries, but it's 6 companies. Therefore, once you understand those 6, you'll pretty much know what's covered. So you can have a list that has Aetna, Blue Cross, Cigna, and go through the codes that you bill. In other words, I don't need you to list every code, just the codes you do and whether they do or don't pay. Once you've billed the insurance, then simply create a spreadsheet that shows what code they allow, how much they paid for it. So the next time a patient comes in, you can simply then refer to that spreadsheet and know whether or not it's going to cover and how much it's going to pay. Bottom line also, though, notice here, I even put injections. Now, obviously, there are only 3 states that can do injections, but if you do injections, certainly something to find out. Now, again, I want to be careful. I'm not trying to talk you into taking insurance. I'm trying to talk you into getting patients. And when a patient has a good insurance, I'm certainly all for saying, hey, why wouldn't I want to give access for that patient? My example is I have a very good insurance policy that covers acupuncture well. I pay dearly for this policy. It costs me a lot of money for me and my employer. When I go to the doctor, I'm not paying cash because I'm paying a lot of money per month for insurance. I'll pay my copays, but imagine my policy, my personal policy with Blue Cross, my policy pays over $100 for acupuncture, and my copay per visit is only $10. I would hate for you to turn me away because you say you don't take insurance. You don't take every plan, but you would certainly take ones like that. Well, let's get into beyond just understanding that verification. What about acupuncture coverage? What do companies cover? Because it's real nice to say, oh, do you cover acupuncture? But let's really understand what that means. And I'm going to pick 2 national companies because this is a national audience, and I want to make sure that you know what the coverage is. The first one we'll take will be Aetna. The next one we'll take is Cigna. Now, these policies with these companies are national. They tell you what they do and don't cover, and yearly they update. So one of the reasons that I want to emphasize this to you now is that I want to make sure you know what they cover, because too many times people guess. So let's take Aetna. So notice this Aetna policy. The policy began way back in 1996, as you'll note at the top here, and the last review was March 29th of 2017. Notice when the next review is. It's coming up. So this policy may update a little bit in the next few weeks and will change. Well, how would you know this update and changes? Well, that's what we do with the Acupuncture Council. We have a network, we have seminars that help to make sure you understand what's going on. But as of now, this is where it's at. But notice what it says right off the bat. Most Aetna plans limit coverage of acupuncture when it is used in lieu of anesthesia. So in other words, what it's saying right off the bat is we only cover acupuncture in lieu of anesthesia, which might as well say we don't cover acupuncture. Now, what's interesting to me is I lecture to about 5,000 acupuncturists a year, and I've yet to find this to be anywhere near even a close majority of acupuncture policies with Aetna. Aetna generally will cover, but it's important you always check to make sure, does this policy cover beyond in lieu of anesthesia? Most you find will, and notice what it says it does cover. Aetna considers needle acupuncture medically necessary for the following conditions. Notice neck pain and headaches. Believe it or not, those are new. Those just started this past year. They used to only cover migraine headaches. Now they'll cover all types of headaches as well as neck pain. It used to only cover back pain. So that's why it's important to always know and follow up to see how these update. Notice low back pain, nausea of pregnancy, or nausea in general. So if you have a nausea vomiting practice, you're always going to be paid by insurance. Notice pain and arthritis of the knee or hip, pain and but knee and hip only, I will highlight. So the frustration for me is if a patient has knee arthritis with pain, they will cover that. But if they have shoulder arthritis, they will not. Now, that frustrates me, but at least I know. If a patient comes to you with arthritis of the shoulder and that's your code, they're not going to pay because they only pay for knee or hip. Notice chemotherapy induced nausea and vomiting. So again, the nausea, vomiting, well covered. Postoperative dental pain. Now here's something interesting. They will pay for tooth pain. They will pay for someone that had dental surgery with pain. So how about working with a dentist that does extractions and so forth, and that they have an alternative to their standard coding that, we also offer acupuncture. I actually know of a few acupuncturists that work in dental offices 2 days a week to just do this type of care for patients who request it. Now notice, it's not their dental insurance paying it, it is Aetna. They will also cover TMJ disorders. So all your TMJ conditions are covered. Now, my problem here is, notice that's a pretty doggone limited list. So while Aetna does have decent coverage, it can pay quite a bit per visit. Its coverage is very limited. In fact, I will state this unequivocally. If you ever get a patient with a policy that says Aetna open choice, you will say welcome, because that is one of their best policies, covers acupuncture very well, and I've seen offices get paid in excess of $100 per set of needles, which seems excessive to some, but that's the amount they will allow. Notice what they say at the bottom, though. Maintenance treatment where members' symptoms are neither regressing or improving, considered not medically necessary. Always understand you are having to make the patient better. Now, better could mean reduction of medication, decrease in pain, increase in function. It doesn't always have to be some sort of, I did an orthopedic test, but just how the patient's responding. But ultimately, do make sure when you're dealing with insurance, the job is to make the patient better, which I'm sure we're all acutely aware of. Now, what I love, though, is that beyond this policy, Aetna tells us what code they cover. Now, notice here it says codes covered as selection criteria are met. And you'll notice it says not all inclusive. Now, the frustration for me is not all inclusive means there's likely some codes they'll cover that aren't on the list, but they're not telling us. So that's frustrating. But what do they cover? You're going to notice right off the bat, migraines. Now notice it's G43001 through G43919. That literally means it's that many. Now it's not 900 migraines, but it is about 40 codes that they'll cover. So any type of migraine covered. Notice disorders of teeth and structures. Notice the K089 is for dental pain. Then notice arthritis of the hip, arthritis of the hip, arthritis of the hip, arthritis of the knee, arthritis of the knee, arthritis of the knee. So all those codes that any type of arthritis of the knee, you ever get a referred patient that had arthritis, knee pain, well covered, not a problem. Notice the codes here, temporomandibular joint disorders. So your TMJ disorder would be common. My statement would be probably just use TMJ disorder, which is M26601, which is for the right side, M26602 for the left side. Notice also cervicalgia or neck pain is covered. Now, something interesting here. It says chronic. Now, the definition of chronic means that it's been there for a while, obviously. But realize that it means it covers neck pain. It doesn't state how you got it. So one interesting part of this is, what if a patient sprained their neck and for months or weeks, if you will, they continue to have neck pain? Even though it's a sprain, how should you code it when it comes to Aetna? Coded as cervicalgia. So no matter what, you're just coding the symptom. I think that's brilliant, really. It doesn't really get into the mechanism as much as just tell me where the pain or the symptom is. Notice the same for low back pain. And then, of course, we have the codes for excessive vomiting in pregnancy, nausea and vomiting, chemotherapy induced, and of course, our plain headache code, R51, just regular plain headache. That's also new. They used to only cover migraines. Now they'll cover headache. In fact, I will tell you pretty much most headache codes, whether it's tension or otherwise, they will code. And that's where you'll say not all inclusive. There's a few more codes that they cover. And you notice at the very top here, this code T451X5, and it says plus. Please note, because it's a T code like the S codes, that means this plus has to be an A, meaning the initial visit and visits with active care. So notice what this code is for: adverse effect of anti-neoplastic immunosuppressive drugs, or commonly known as chemotherapy-induced nausea. And so this would be the code. So if someone has chemo and nausea, this is the code to use. But here's another one. Notice this code here, Z98890, other specified post-procedural status. This is the code for post-procedural pain from surgery. This one is noting it as dental pain, which of course that's what they cover. But just as a special note, if you're ever coding a person that said, I had knee surgery and I continue to have pain, this also would be the code. So now you can see here, this is about 90 codes that are covered for Aetna. While that's a good size list, it's not everything. So here's what I want you to take away. When you have an Aetna patient, If the code is not on this list, they're not going to cover it. So don't fool yourself. I will certainly say I'll take an Aetna patient, but if they're coming in with tennis elbow, not going to be covered because they don't cover tennis elbow. So make sure it's got to be a condition covered. And that way you can let the patient know, unfortunately, your plan doesn't have benefits for that. Now, when they come with headaches and other things, no problem. You'll see here it just talks about documentation requirements. What I will boil down to for documentation, and you can take some time to read this on your own, is this. Document the patient's getting better. Document the services you provided. Okay, make sure acupuncture requires, of course, time as well as where you do the needle sets, but ultimately just make sure they're better. Now, what I like here is now you actually can see what Aetna covers. You're not guessing. So when you call Aetna, you don't need to ask them what diagnosis codes they cover. We know. What you want to find out is the policy in effect, and does it cover beyond in lieu of anesthesia? Well, what about our next coverage here? Here's another policy. This is Cigna. Now, Cigna, in my opinion, better coverage. Reason why? They have a better coding list, a better understanding. But something interesting, notice again, the effective date was March 2017. Next review is March of this year. Therefore, when should you look for this policy to change? In March. I can guarantee a change on this one because there's a code that's been updated, which I'll point out to you. But ultimately, it's why you always want to stay on top. And it's part of the reason you do continuing education. You always have to be learning and getting more information because things do update and change. So bottom line here, take a look. First bullet, treatment is expected to result in significant therapeutic improvement. And that's one important factor. You want to see a therapeutic improvement. Reduction of pain always equals increase in function. So if you do that, you're probably going to be safe. Ultimately here, notice it says what following conditions? Nausea, 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 so well covered nausea. Dental pain as before with Aetna, but then it says here migraine or tension headache, arthritic knee pain, neck pain, low back pain. And that kind of looks like, well, Sam, that looks like the same thing that Aetna covers. Well, yes and no, but they define these a lot differently. So take a look at the diagnosis codes Cigna covers. Immediately you'll see this list like, wow. So notice again, all the migraine codes, but then notice also tension headache codes. Notice post-thoracotomy pain, meaning post-surgical. Post-procedural pain, acute. So notice this is acute pain after surgery, vomiting, knee pain. And then notice this code, spondylosis without myelopathy. Now you might say, oh my God, what is that? Or with radiculopathy. You know what spondylosis is? In simple terms, that's the fancy term for someone that has neck arthritis. Now, here's the difference. For Aetna, you actually could code this patient. Why? Because this condition will cause neck pain. But for Cigna, they're saying, no, don't code simple neck pain. Really tell me it's spondylosis. What I think is good about that is spondylosis is more chronic. Spondylosis is more continuous. Once a person has arthritis, as much as we'd like to believe we can cure it, we can certainly manage it and make it better, but they're going to flare up. So it's going to be much more clear that this patient is going to have more chronic and returning. So instead of just putting neck pain, so I like that. Notice all the codes for spondylosis. Notice at the bottom, spinal stenosis. Again, that's that pain come from stenosis or narrowing of the spinal column or spinal canals causing pain or neuritis. So we go to the next page, you'll notice, wow, this list continues. Notice spinal stenosis, but I'm going to highlight one at the top. Notice M4806 spinal stenosis lumbar. I'm going to highlight, I know this is going to update because this code changed October of 2017. The new code is M48061, which is spinal stenosis without claudication, and M48062 for spinal stenosis with claudication. And you might think, oh my God, what is that? Well, that's stenosis with claudication means there's pain radiating down the leg. Without claudication, there's not. So that's one we know we're going to update. But notice, don't all these codes really relate to neck pain? So in reality, you could code this for Aetna, just not as specific. Notice all these codes for disc injuries. Disc, all neck and back. Now, the difference here is, instead of saying neck pain, you can tell me what's really going on, because let's face it. Let's take the code here, M50221. Other cervical disc. If someone has a disc displacement, meaning disc bulge also, wouldn't you think that person needs a lot more care than if you simply said neck pain? And so what I like here is that Cigna is really giving a purpose behind the care, that it's going to be clear this is not going to be 5 visits, they're going to be better. Well, let's continue on, because you'll notice it continues with all the disc codes, but then notice things like cervical cranial, cervical brachial. Those are conditions that cause neck pain that radiate with a syndrome with symptoms to the upper extremities and head. But notice it does cover things like cervicalgia, sciatica, obviously back pain and dorsalgia. So again, just a much broader, more defined. What I'd say that Cigna does is kind of give more of a Rembrandt description of the diagnosis as opposed to a simplistic one. It's not a stick figure. Notice also all the dorsalgia. Dorsalgia just means back pain. This means, like, for instance, you would use other dorsalgia for things like facet syndrome. Those don't have a code, so you'd use other. Then notice they even get into the codes here, segmentosomatic dysfunction. Those are the codes that chiropractors use just to indicate subluxation. And then notice all these additional codes for stenosis. And finally, again, more stenosis codes, but then notice hyperemesis gravidarum. Okay, so notice here that's a woman that's pregnant, obviously, and vomiting. But then we have nausea, vomiting unspecified. Let's face it, R11.12 is not something you want to see in your office. Projectile vomiting. So here's what I want you to take away. Notice the list now. Now again, you may not use every code here, but take a look when you're billing a code to Cigna. Is it on the list? If it's on the list, get paid. Not on the list. So that way you can have a really good regimented way of dealing with insurance policies. When it's covered, let the patient know it's covered. When it's not covered, we don't take it. Or we let them know your insurance won't cover, but what we're going to do is, of course, help you in getting some benefits if there's something covered. If not, they can pay cash. Okay, we're also recovered. Now, beyond just Aetna and Cigna, I just want to highlight to everyone, HealthNet and TriWest offer Veterans Choice, which is coverage that literally covers acupuncture. Now, here's the really cool part about this. This coverage covers acupuncture, exams, and therapies if authorized. They pay at Medicare rates, which you might say, wait, Medicare doesn't pay. No, Medicare doesn't pay, but Medicare sets a fee. The approximate allowance for the first set is $45. Additional sets are $40. And they generally will allow as many sets as necessary, assuming 2 to 3. This is a good $100 per visit. Depending on where you're located, you have to join the Veterans Choice either through HealthNet or TriWest. HealthNet is essentially East Coast, TriWest is West Coast. I've given 2 links here to take through and go and take a look to join, and I would simply say just join. Here's the breakdown of where it's covered. Sections 1, 2, and 4 are HealthNet. If you're in the States for 3, 5, and 6, that's going to be TriWest. Please notice some states divide up. You notice Southern Illinois is going to be TriWest. Northern Illinois will be HealthNet. But I would certainly say that's an area to look at, because think of how many veterans there are. And this benefit has been pushed through by President Trump for at least another year. The key factor, join and get authorization. Here's the real good part. The patient, meaning the veteran, does not have to pay any copays, any deductibles. This is a patient that with exams, let's just say it's about 5 visits with an initial exam and acupuncture, you're talking approximately about $500 to $750 in reimbursement for that patient and someone you're going to help that probably has a chronic condition that they're going to come in more often or need to come further. Why are they doing this? Because veterans have a difficult time getting appointments. So that's another area that you may not think you want to take insurance. And I would certainly say be careful. But there's certain plans I would take. Would I take a veteran? No doubt. So long as it's been approved, guaranteed payment. Would I take an Aetna policy? Absolutely, so long as it fits within that plan. And then ultimately, would I take Cigna? Same idea. Does it cover, does it not cover? So take this information I've given you today and say, hey, wait a minute, let me go into this. Let me start to look at what plans cover. And though you may say, I don't take all insurance, which I expect, there could be sometimes you'll take others. Now, one thing with chart notes, and this is going to go with whether or not you're taking insurance or not, please make sure your chart notes reflect the services you build. If you've done an exam, make sure the exam is clear and separate, that you can see there was a separate exam above and beyond what's normally done with acupuncture. Remember, when coding acupuncture, there are 2 components required, time face-to-face with the patient, as well as insertion, and that has to be reflected in multiple sets. And remember the 15-minute rule of acupuncture, which is the 8-minute rule, really, at least 8 minutes for the first set, 23 for the second. And the same applies, of course, when you're dealing with any type of physical medicine as well. If you do physical medicine, I say great, just make sure to document it. What did you do? Where did you do it? And if it's a time service, how much time did you spend? Then ultimately, make it simple on yourself. Acupuncture works really well. I don't have to tell that to any acupuncturist. It works. What does it do? It reduces pain, increases function. So document that. So demonstration of effectiveness really comes down to two things. Show me a decrease in pain, decrease in use of medication for that matter, increase in function. I've never had a person that go, my pain is better, but I still can't do anything. So always highlight what they can do. And I would suggest utilizing some type of outcome assessment. Make it simple. Every provider in the US, except acupuncturists, healthcare providers, do have to use outcome assessment forms as part of the Medicare protocol. I'm going to suggest that you should start implementing this office because it's one of the easiest and simplest ways to demonstrate that your patient is better. So there's the neck and low back disability or a general pain index. Well, here's an example of the general pain index that you can use. The general pain index, you'll notice, is just a simple form, 6 questions. The questions don't focus on how much it hurts, but how your function is. Notice it's a 0 to 10, completely function to unable to. And the variation is here, family and home responsibilities, recreation, social, employment, and so forth. The simple truth is a patient comes in on the first visit. They fill this out and circle. You give a point total. That point total becomes your baseline. As you treat them 3 visits later, 6 visits later, whatever, do this form again. They should improve at least 5 points. Notice at the bottom it says benchmark. That's all we're looking to see is that they've improved 5 points. Truthfully, you're going to find most patients improve a lot. And what I mean is that they may start with a 50 point. After 5 visits, they'll drop to 25. Maybe after the next visit to 15. Then all of a sudden it gets slower. We're not trying to treat to 0. But if someone says your care is not medically necessary and you've used a form like this, I'm pretty sure you've shown it because you've shown the functional change of the patient, not just my pain went from a 7 to a 4. And so I think that's going to be far better. So in other words, whether it's cash, whether it's insurance, document your services, show the patient is better, and we're here to help. And now, where does the American Acupuncture Council come in? How do we aid in your success? Here's our website, AAC Info Network. And this is what I implore all of you. We're here to help you. The American Acupuncture Council is not just your insurance company. We are your support. So what does the American Acupuncture Council do? Well, one thing, go to our site. So you can see the site now. We give you 4 tabs, digital code. And there's one thing I want to highlight. It's the new year. Are you up to date? I've given you just a quick note of what's going on. But go to our site, click on billing seminars. And when you go to seminars, you'll see we have our advanced coding and billing. So I'm going to just go here just to learn more and just give you an update. What's going on with our seminars this year? On the right side, you'll notice all the locations. But more importantly, I want to highlight the 2018 updates. Obviously, I just showed you Aetna and Cigna, but what about Blue Cross, Blue Shield, United Healthcare, ASH? We're going to give very specifics of each of those. We're going to go through the ICD-10 and CPT updates for the year. We're going to go through, depending on your state, your work comp fee schedules. Also, one of the things we're going to cover is the RB, RVS, and RVU, and this is just the value. Most acupuncturists have no idea how to set a fee schedule, what one code compares to the other. Our seminar gives a chance so you'll know that when you bill a 97810 at $75, if $75 is your fee, what should the other fee be? And we'll do this through RVU. We'll also cover those because obviously we realize that most acupuncturists have an integrated practice, so we go over the legalities for discounts. Can you give cash, prompt pay, prepaid? How does those go into your practice? In addition, we go through a whole thing on E&M coding, properly choosing an E&M, understanding when is it a new patient and an established patient. How many bullets does it take? So you'll see here it says assuring the bullets. For instance, when you bill a 99203, it's not that you spent a half an hour, but it's that you did 12 or more bullets on exam. How to use extended code services, 99354. We go through all the CPT, acupuncture codes themselves. We give samples of how to document them. We actually make it a little workshop so we have everyone document to see that they're doing it properly. We do the same with physical medicine codes. We go through in detail this equality part about what codes you can and cannot use, what modifiers are necessary, how to deal with timed versus untimed services, how to code for things like tuina, washa, cupping, moxibustion, massage, exercise, and so forth. But we do take some time. Cash. We understand there's going to be a lot, and we focus on that for you to make sure understanding to do it legally. In addition, what about hardships? What about managed care? Should I join? Should I not join? We give you the tools to make sure you can go through in your office how to make sure whether it's of value to join a plan or not join a plan. In addition, personal injury. Obviously, acupuncturists can treat personal injury patients, but you have to evaluate. Is it a good claim? Should I take it? Where's the money come from? What is PIP? What is med pay? What about excess med pay? Or I've heard about attorneys with LOPs or liens. Which ones do? We give samples of each of those. Obviously, workers' comp, the acupuncturist role. One of the nice things is that we had a state that never covered acupuncture before for work comp that now is, and that's the state of Washington. But most states do. They have specific fee schedules and protocols we want to follow. And then ultimately, we finish with documentation. Documentation, what we want to make sure is that do your notes reflect what you've done? I don't want any acupuncturist to ever panic if someone reads your notes. I want you to understand how it's done properly. Unfortunately, often in schools, what you were taught doesn't match the real world. So we want to make sure to kind of meld those of being that really good practitioner, what you were taught in school, and how to make sure we're communicating that. So I would say, please take a look. You'll see on the right side here, we have all the locations coming. This is just through April. We'll be in other places. Give us a call. We want to make sure that you've got the right information. And here's what's really cool. All of our seminars are continuing education certified. You'll get your state as well as national hours. And remember, those are required, and you might as well go to something that's going to give you real world business. The other thing that we have is a service that we call the network. So if we go back to the main page, the network is a service where reality, Sam becomes part of your office. So when you get into the network, there's a little video here. You just simply join. When you join, you can immediately send me a question via email or fax, or give me a call. It could be a simple question such as, hey, Sam, I need a code, to, hey, I got a denial. How do I approach it? Or I've got a Medicare patient that has a secondary insurance with benefits. How do I deal with that? Or I've got an attorney, or I'm wanting to set up a prepaid plan. We help you with all that. Now, here's the beauty. It's only $175 for an entire year. Unlimited. Call me with a simple to complex question. If you're a new practitioner that you're saying, you know what, I don't even understand how to bill insurance. Good, give me a call. We'll go through it. That's what we're here to do for you. The American Acupuncture Council wants to make you successful. The other thing that we have is our digital coding. The digital coding is nothing more. We don't print a book anymore. We simply put it online. And so you'll notice this, once you log into this, it comes up with all the areas. You can click on diagnostic codes. And when you click on diagnostic codes, you can go through, well, I want to pick an area. So I can click on the head, and this will then give you all the codes that relate to the head. Now I'll put them in order here, but you can see things like post-concussion syndrome, migraine headaches. Now notice the migraine headaches. All these codes that I gave you earlier, here they are in order. But what if you say, well, I just want the migraine codes? Go in the search bar, type in G43, since that's the parent number. And when I click the search on that, notice all the migraine codes come up. So remember that G43001 through G43919 I gave you? Here's all those codes. So you can go through and decide, well, which one should I do? Or what if you're saying, I didn't know that. What if I type in the word migraine? If I just simply type in migraine, it gives me the same list. So you can search for codes based on location, keywords. So if you say, hey, I have a person with Parkinson's disease, you can type that in, or flat foot. I'm getting a little out there with some of those, but what about just plain headache? Those all are there for you. In addition, what we've added in is a document library. Now, well, let me just go here. There's other things we can do, like allergies, female issues, menstrual issues. So it's not just body areas, but conditions. And we focus on the things that are covered by acupuncture. But what we also have is a document library. And in this document library, we have, for instance, a 1,500 claim form. So some of you may say, oh my God, I've never billed insurance before. No problem. I'm going to go ahead and open this up. And notice, oops, I hit the wrong one. That's how to fill it out. I need to open up this one, the blank form. Notice this form, once it pulls up, you're going to notice it's a 1,500 form. And notice what I can do. Type right into it. Then I can print it and save it. So I don't have to do anything other than just have this program, and I can do all my billing. This alone is over $100 if you're to purchase that separately, if you did a place online. But what we do have here are all the different things that are covered. So I'm going to drop down, and then we go here to insurance acupuncture policies. So notice we have Aetna, Blue Cross, Blue Shield. Now I'll just tease you a bit with this Blue Cross one. This Evacor one is a large document. I'll give it a moment to open. But with this one, this gives you the basics of what they cover. And this details, and I'm just going to go down. Look at the conditions they cover. Headaches, cervical, thoracic, lumbosacral, upper extremity, lower extremity, neuromusculoskeletal. But notice internal medicine, rhinitis, asthma, and so forth. And it gives actually the codes, what's covered, what's not covered. So that's something we detail in there. That's something you get at our seminars as well. We also have treatment guidelines. So the newest ones that just came up, this just started this year, are ACOM guidelines. So these go into all the different areas where it's ankle and foot, cervical, elbow. And when you go into these, once you open them, you can do a search for acupuncture and it'll bring you right to the acupuncture section. And then finally, one of the things we have in this document library is some of you may say, look, I don't want to do insurance. We get that. Click on the super bill. So notice here, we're going to have a super bill. I'll open this up and notice what it is, a super bill. In fact, let me enlarge it slightly. And you'll notice this has all the codes, check off what you did, any modifiers, the fee. In fact, if you want to put in a diagnosis, you can, but we've also listed diagnoses over here so that you could just simply circle the diagnosis for that patient. In other words, give them a simple, fast, and easy receipt. We understand that you're not going to do only insurance. You're going to do some. And so we try to make sure that we give you all the tools for that. So that's the digital coding. That by itself is only $79.99 for an entire year of this access. Now, here's the beauty. Remember I said that these codes are going to update? Guess where they're going to update also? When they're updated, we update them here. The American Acupuncture Council is here for you. Take a look at our website, AAC Info Network. It's the new year. Set yourself up for success by getting more people. Any business knows success comes from having patients, people you can help. People are going to be excited to come to you. If you help someone, they're going to tell their friends, and they're going to be willing to pay, whether cash or if they have insurance. What I want to make sure is that when someone has insurance, I'll give them a chance to access it. The other factor is make sure you have the tools. The American Acupuncture Council is here for you. Take some time, go to the website, search around. If you have questions, just simply give us a call. You can reach us at 800-562-3335 or go directly to the website. You can submit a question there. We're here for you. We want to make sure you're successful. We wish you a really good new year and lots of success. I hope to see many of you at some upcoming programs. We look forward. We have other presentations coming this year for you that are all business and acupuncture business related. And we're excited for you. We're excited for ourselves because we know the business is going to continue to grow because acupuncture works well. And I'll leave you with one last quick note. Don't forget, acupuncture now has become the real beauty of healthcare because who can better deal with opioids than with acupuncture? So until next time, thank you for spending some time with me.